Okay, so now we're going to talk about the reproductive system. And we're not going to talk so much about the anatomy of the system as some of the effects that occur with the system. We're going to talk about pregnancy, childbirth, conditions of the reproductive system, and means of birth control. So, let's take a look first at the effects of pregnancy on the mother. And there are a wide range of physiological effects that occur with the mother during pregnancy. Pregnancy is considered that period from conception until birth. And the anatomical changes that can occur, you get enlargement of the uterus, of course, because the uterus is just about a pear-sized organ when you're not pregnant. So it stretches, enlarges a great deal, actually builds more muscle, which is one of the few areas that muscle cells form, and then they decrease after the child has been born. So we have that, we have enlargement of the uterus, we have accentuated lumbar curvature or lordosis, that is kind of a swaying of the back. We get a relaxation of the pelvic ligaments and pubic symphysis due to the production of a hormone called relaxin. This occurs a little bit later on in the course of pregnancy, right toward the end, but this hormone has multiple side effects. It causes the pubic symphysis to become softer, which allows a little bit more wiggle, which allows the great big baby's head to go through the little tiny opening. It also relaxes some of the ligaments and tendons in the feet, resulting in a spreading of the feet. Actually, women's feet will enlarge sometimes a size or two after they've had children. It also softens the connective tissues in the veins in the heart, or not in the heart, but in the veins in the legs. This can lead to varicose veins. It is a combination of the effects of this hormone and the relaxation of those tissues in the veins, as well as additional pressure on the heart from the baby that can result in these varicosities occurring. Now, some other physiological changes occur within the GI system. There are several physiological changes that occur to the GI system. First, the one that you're probably most familiar with is morning sickness. Everybody's heard of that, and that is due to elevated levels of progesterone and estrogens in the system. Also, you see heartburn because of organ crowding by the fetus. That is, big fat baby's head is pressing up against the stomach, up against the diaphragm, and so you have some forcing of the gastrointestinal stomach acid into the esophagus, which results in this heartburn. Constipation is caused by declining motility of the digestive tract. Now, when we look at the urinary system, there are a couple of changes that occur there. We have some physiological changes. Kidneys have an additional burden, so they have to produce more urine. That is, you are basically cleaning the systems of both the mother and the baby at this time. The uterus compresses the bladder, and the uterus lies on top of the bladder. So as the baby gets larger, it squeezes the uterus downward, and you end up with very little space in the uterus for urine. So the uterus gets compressed, and you can have stress incontinence. That's you urinate when you sneeze, when you laugh, when you cough. Frequent urination because the bladder cannot hold nearly as much urine, so you have to urinate much more frequently to get rid of the increased volumes that are being produced. And then small quantities are urinated. Again, the bladder being compressed, you just don't have that much room for urine to be stored. Now, affects physiological changes to the respiratory system. Nasal mucosa becomes congested and swollen, so pregnant women seem to feel stopped up and congested all the time. The vital capacity, that is the total volume that you can breathe in, increases, as well as the respiratory rate, and you get dyspnea. That is difficult breathing, which occurs during the later stages of pregnancy, again due to big baby pressing on the diaphragm. Some changes in the cardiovascular system. Your blood volume increases by 25 to 40%. This accounts for the kind of glow that they talk about with pregnant women. Basically, there is more blood there, so their faces are a little redder, etc. Blood pressure and pulse increases, and so the heart is beating faster to move more blood. Blood pressure is increasing because you've got thicker blood and your heart is beating faster and harder. This can reach dangerous levels. Not always, but it is quite common that you can have some dangerous levels of blood pressure occur. Varicose veins are common, and I mentioned before that you have this relaxation of some of the connective tissues that are in the veins. Add to that this increased blood volume and blood pressure, and you can end up with these varicosities. Due to pressure on the right side of the heart becomes inefficient. It is the diaphragm is pressing up against the heart, so it cannot recuperate blood from the body as efficiently, and you end up with swelling of the extremities. Now, labor itself, that's a series of events that expel the infant from the uterus. These are rhythmic expulsive contractions. They operate by a positive feedback mechanism. Basically, big baby's head pressing against the tissues causes press receptors to pick up and cause a release of oxytocin, which increases the muscle activity, which increases the pressure, which leads to more oxytocin release and so forth. Now, there are some false labors that occur. These are called Braxton Hicks contractions. They are weak and irregular uterine contractions, but they can trick you into thinking you're going into labor. Basically, the initiation of labor starts with the baby changing position. It gets into a head-first position. This leads to some changes like estrogen levels rise and uterine contractions begin. Now, once the baby is in that position and the contractions begin, what that will result in is pushing on these pressoreceptors, which causes the placenta to first release prostaglandins, which cause also some contractions, and oxytocin, which is released by the pituitary. Combination of these hormones produce additional contractions, and so that's why the contractions kind of come in waves. What you see is all of this contraction results in the baby's head moving a little bit lower into the cervical canal, resulting in additional stretch, which results in more signals to the hypothalamus, which results in more contractions. This just kind of sums up what we're looking at here, and you see multiple steps. First off, the baby moves deeper into the mother's birth canal. Then we see pressoreceptors in the cervix of the uterus get excited. We send signals, I don't care if it's afferent or efferent, but signals get sent to the hypothalamus. Hypothalamus sends impulses to the pituitary, where oxytocin is stored. The pituitary releases oxytocin into the blood, and the oxytocin targets the mother's uterine muscle. That causes additional contractions, and you just go through that cycle over and over again. So when they start saying that, contractions are coming every 5 minutes, basically you're cycling through this every 5 minutes or so. Now, stages of labor itself, we have dilation. That is the cervix, that part of the uterus, the lower portion becomes dilated, and it is fully dilated at 10 centimeters. Uterine contractions begin and increase. The cervix softens and effaces, that is, it thins a little bit, and the amnion ruptures, breaking the water. This is the point when you definitely know you are in labor, and it can be quite surprising. My sister-in-law, she was standing in line at a Taco Bell, waiting for her burritos to be sent to her when her water broke, just right there in the middle of the store. She refused to leave until they brought her burritos. She just was like, "You've got a little mess here to clean up. Let me have my burritos." So this is the longest stage, and it lasts 6 to 12 hours. We have here just a dilation of the cervix. You see what's going on there. A little stretch occurs in the cervical area. Expulsion is when the infant passes through the cervix and into the vagina and out. And it can last as long as 2 hours, but is typically about 50 minutes in the first birth and 20 minutes in the subsequent births. Now, I know we've heard all sorts of stories about women who were in labor for 30 hours or something like that. It tends to be the previous stage that takes the longest. This is relatively quick once we get to this stage. Normal delivery is head first. However, you can have a breech delivery where the baby has not changed its position, and you end up with buttocks first instead. So here we see expulsion or delivery of the infant. The placental stage is delivery of the placenta, and usually accomplished within 15 minutes after the birth of the infant. This is what we call the afterbirth. The placenta and attached fetal membranes come out. All the placental fragments should be removed to avoid postpartum bleeding. And just as a bit of trivia for you, a placenta weighs about 1/7 the amount of the baby, for what that's worth. So if you have a 7-pound baby, you're going to have about a 1-pound placenta. And here we see. And this is a good stopping place. We will pick up on developmental aspects of the reproductive system in our next presentation.